Hello everyone, and today we'll talk about tips prior to fixed restoration. Let's begin with the first tip.
So, if it appears that the opening is limited or the movement is slowed, ask the patient to point the area where that hurts. So, if the patient touches a muscle area as opposed to the TMJ, there is probably some disinfection of the neuromuscular system. So, that is the cause. Okay. Patient experiencing a problem with one or both TMJ will most frequently point to the joint itself. Okay, this photo show where, where the patient finger is touches now to detect the heart uh, position or pain position. As we said before, is a boost to the TMJ, so it's a neuromuscular system causes. And now, does the patient suffer from frequent occasion of head, neck, or shoulder pain? If so, an attempt must be made to determine the origin of such pain. It may be referred pain.
And do you know that the healthy TMG function with no evidence of pain, asymptomatic clicking or crepitation occurs in about one third of general population? That means the patients have a problem with the TMJ without any symptoms, without any pain. So, so what's the solution now?
Let's begin with the first solution. Patient history should be investigated. That means uh, the patient history should be determined if any TMJ pain or just a treatment of the TMJ should be recorded. Okay.
And now another solution is to limitation of movement on opening, closing, or moving laterally should be investigated further to determine the condition of the TMJ.
That means we ask patient to open and close his mouth and move lateral movement with his mandibular to determine any pain or any symptoms with this movement should be recorded and should be noted. That is easy to determine the TMJ healthy and condition. And now let's talk about palpation of the joint during opening or closing. That helps to existence of any signs of disinfection, okay, of the TMJ. Okay, and do you know habits such as clenching the teeth and manipulating the bite during the course of the daily routine may result in fatigue and muscle pain? The physical appearance and activities of the patient should be observed for signs of such habits. And many times they will have a square jawed appearance. That means that his jaw it changed from normal to to square shape because of the bruxism and excessive clenching of his teeth.
And with master muscle that are overdeveloped from the hyperactivity, they may even clench their teeth during the patient interview. That means that when the dentist ask the patient anything, from the stress, the patient clench uh, his teeth, and that is a very huge problem because it affects negatively on the fixed restoration. At the end, thank you very much for listening, and don't forget to like and subscribe our channel. Goodbye.